Okay, so the next underlying root cause of chronic back pain that I want to go over involves the imbalances that can develop within your hip muscles. So in this module, I'm going to go over a brief review of the anatomy of the hip muscles. And from there, I'm going to talk about how imbalances of these hip muscles can cause and contribute to chronic lower back pain. And from there, we'll share with you three of our favorite ways to help you fix and balance out these hip imbalances so that you can learn to take pressure off of your back, which will help you stand taller for way longer and be able to walk with way less back pain as well. So let's begin with a brief outline of the anatomy of the muscles of the hip. So first off, we have the muscles that sit in the back of our hip known as the glute muscles. And the glute muscles comprise of three muscles known as the gluteus maximus, the gluteus medius, as well as the gluteus minimus. Now, the gluteus maximus is the largest of these three glute muscles and is the primary muscle that creates a motion in your hip known as hip extension, which refers to the direction of movement where your hip is moving backwards. But the glute max is also the powerhouse muscle that allows you to do things like, squatting and lifting, getting out of a chair or getting off the ground. And the glute medius and glute minimus muscles that are the muscles that sit on the side of our hips. And these muscles play a huge role in terms of helping you stay balanced and upright in terms of side-to-side stability or standing on one leg. And underneath these muscles sit a much smaller but also very important set of muscles known as the lateral rotators, whose goal is to not only create rotation of your hip, but also helps maintain stability of your hip joint as well. And then finally, we have a very important set of muscles that sit in the front of your hip, which are known as the hip flexor muscles. These muscles are usually known as the psoas major and the iliacus, and their role is to create flexion of the hip, which occurs when your hip is kind of moving out and up in front of you. And these muscles, specifically the psoas major muscle, plays a huge role in terms of spine mechanics because of the very attachment it has right on your spine and how it attaches all the way onto your hip into your pelvis as well. Now, as important of a role that all these muscles play in terms of creating movement in your hips and in your legs, another very important role these muscles also play is the fact that they're also responsible for helping maintain stability within your pelvis, which is this bowl-shaped object that also serves as a foundation for your spine. And as you can see here, when these group of muscles are able to work together and are in proper balance, the pelvis here is able to stay level, which is obviously what we want as a foundation for our spine. But what happens is when these muscles become imbalanced, which is usually going to occur because of a combination of a tightness and shortening that develops on the muscles in the front of the hip, usually because of a long periods of sitting or lack of stretching, as well as weakness and inhibition of the muscles in the back of the hip that comes from a lack of use and the fact that people spend so much time literally sitting on these muscles all day long and are not being used. You get a scenario where the pelvis then starts to tilt forward into a position known as anterior pelvic tilt. And as you can see here, when your lower back then starts to get pulled into a hyperextended position known as hyperlordosis, which we have also talked about in the first two modules already. However, by learning how to rebalance these muscles through a series of exercises that we're about to show you, you can actually start to offset some of these problems that develop from the weakness and the tightness that has developed in your hips. And as a result, you will start to level out your pelvis, which will then allow your lower back to kind of naturally settle back into a less stressful and more comfortable neutral position, which will help take a significant amount of stress and pressure off of your lower back, which will then help you be able to stand taller for way longer. And again, just put your back in a better position where it will start to heal over time as well. So what we're going to do next is to walk you through a couple of our favorite ways to help you correct and rebalance out your hip muscles. And we'll also walk you through some of the most common mistakes that people make while doing these exercises, followed by teaching you, again, the correct form and how to perform these exercises correctly so that your back can start to feel much better over time as well.
Okay, so the first exercise that we want to show you in this hip imbalance module is an exercise known as a kickback. So we love this exercise because of how easy it is to do for our patients, but also in terms of how much information it provides about the current state of your hip muscles, and also when done correctly, as we're about to show you, how effective it can be in terms of helping you correct some of these hip imbalances, which can help take a tremendous amount of stress and strain off of your lower back. All right. So what Twee's going to do here is she's going to start by starting on all fours on her hands and her knees. And she's first going to just start by sliding her right foot back and then very slowly lifting up her leg as high as you can, but also making sure that her back is staying straight and her hips are staying level like so. And she wants to hold it at the top for about 5 seconds. So 3, 2, 1, and slowly bring the leg back down. All right. And from there, she's going to perform it a couple more times. All right. So what she's going to do here is, again, she's going to start by sliding and lifting her leg up. And what you should be focusing on is feeling a very strong contraction in both your glute muscle right here, and also a strong contraction in your abdominal muscle right here in the front as well. And bring it back down. And it's important that, again, you try to keep your core muscles tight, because this is going to keep your back stable and prevent your back from overarching, like we've kind of shown you in the first introduction part of this video. All right. So the next thing I want to do is just show you a couple of very common mistakes that people make when they do this exercise, to make sure that you don't make some of these common mistakes as well. Right. So the first mistake that will happen when people do this exercise initially is when they lift up their leg, is that their lower back is going to have a tendency to want to overarch into this position, like so. All right. And again, this is a sign that the lower back muscles are just overcompensating for the hip muscles, or that the person is just trying to lift their leg too high. So if this is happening too, just make sure that your back is staying, completely straight like so, and just make sure that your lift isn't going up as high if you start to feel that your back is starting to overarch. Okay. And now the next mistake that people make, just to change up the angle here so that you can see, is that when people try to do this exercise, is that their hips and their pelvis is going to be off level like so. So as you can see here, her right hip and her pelvis is popping way up to the side here. And what we want to do instead is to make sure that your hips are staying more level like so. And this is going to make sure that you are just trying to retrain the proper stability and the overall balance within your hip muscles, so that your hip and your back muscles aren't overcompensating for the weakness of these glute muscles. All right. Okay, so let's just demonstrate it a couple more times properly, just so that you have, again, have an awareness of what you need to do. So again, just kicking or sliding, kicking the leg high. Make sure you feel a nice strong contraction in your glute. Make sure your back is staying as straight as possible. Make sure your core is staying tight. And hold it at the top for 5 seconds. 3, 2, 1, and back down. Let's go ahead and show what it looks like on the left leg. All right. So starting with a nice slow slide of the leg back, lifting up the leg as high as you can, while making sure that the hips, again, nice job staying level, and that the back is staying nice and straight and nice and tight. And hold it there. 3, 2, 1, and slowly bring the leg back down. All right. So we suggest performing this exercise 5 repetitions on each side, and hold the exercise for about 5 seconds and perform 3 sets on each leg. And what you find is the first couple times you might do this, it might feel very awkward or weird, or you might not be sure that you're doing it correctly, but that's okay. The more that you practice and the more that you're paying attention to your form, over time, your body will start to learn how to kind of self correct some of these imbalances over time, which can eventually bring a tremendous amount of relief to your lower back over time as well. All right. So that is it for the kickback exercise. Now let's move on to the next exercise, which is known as the glute bridge. Okay, so the next exercise that we want to show you is an exercise known as the glute bridge. Well, this is a very commonly prescribed exercise in physical therapy. I find that most of our patients haven't been taught this exercise properly, which just can lead it to being a waste of time for some of our patients. We want to make sure that when you do this exercise, that you do it correctly, so that you can get most of the benefits as you can out of this exercise to help you correct some of these hip imbalances, and also try to bring some relief for chronic back pain as well. All right. So what Twee's going to do here is she's going to start by laying on her back with her knees bent, and she's going to start by just flattening her back into the mat like so. All right. Now this is a very important part of this exercise, because it's going to prevent your back from overarching, as we're trying to teach you how to use your hip and your glute muscles to be able to create that kind of lifting through your hips. All right. So once her back is staying straight by her engaging her abdominals, the next thing that she's going to do is start to lift her hips up slowly and very gradually as high as she can, while making sure that her back is staying straight and that her core is staying tight as well. And hold it at the top for 5 seconds. So 3, 2, 1, and come back down and reset. Nice. All right. So let's just demonstrate it one more time. So she's going to start by flattening her back into the bench, and she's going to start by just slowly lifting her hips as high as she can, while making sure that her back is staying straight and her core is staying tight like so. So hold it there for a couple more seconds. 3, 2, 1, and come back down. Now, as you can see here, you can actually start to see at the top where Twee, her core and her back muscles actually start to shake and quiver a little bit. And if this is happening when you do this, that is completely fine. This is how you know that you're doing the exercise correctly and that your muscles are getting the most out of this exercise. All right. So, what we want to do next is show you a couple of very common mistakes that might occur for people who might have a lot of these hip imbalances and want to show you how to correct them. All right. Now, the first mistake that people make is that when they perform this bridge, is that they will just start to simply kind of lift from their back and instead of lifting from their hips. And in doing so, it'll kind of look something like this, where their back is kind of overarching. They're not really getting a lot of good contraction through the glute muscles and are just putting a lot of pressure and stress on these back muscles that are already overworked. So, if you do feel a lot of stress or strain in your lower back, or if you don't feel that your hips are moving or being used as much, then make sure that you just go ahead and settle back down and make sure that you really start by practicing flattening your back into the floor first. And this will prevent your back from overarching and then perform the lift from there. And as you see here, her back is going to lift way less, but she's going to get a lot more engagement through her glutes and a lot less recruitment of her back muscles. Okay. So go ahead and come back down. Now, the next thing that might happen, especially for people who are doing this exercise for the first time, is that they actually might start to feel their hamstring muscles cramping up. So, if you start to feel a lot of stress or a lot of pull in the muscle in the hamstring right here, then again, might be a sign that your glute muscles aren't working as well as they need to because the hamstring muscles are working harder than they should. So, if this is happening to you, then just simply don't lift as high, and again, just try to center your focus on squeezing through your glute muscles and try to force that pressure away off of your hamstring muscles. Okay. So go ahead and reset tweet. So let's just demonstrate this exercise just two more times, just so that we can really dial down the form and technique. All right. So flatten the back into the floor, lift the hips up in the air, squeeze the glutes as tight as you can at the top, and crunch those abdominal muscles as you can as well. All right. So again, if you start to feel a lot of shaking or quivering at the top, again, that is a sign that you're doing this exercise correctly and all of the right muscles are working. Okay. 3, 2, 1, come back down, and let's practice it one more time. All right. So, like most of these exercises, again, these exercises are way more difficult than they look. But just take your time with these. Go slow, but stay consistent with doing them each and every day. We recommend practicing at least 5 repetitions and hold the bridge for at least 5 seconds, and try to perform 3 sets of these exercises per day as well. All right. So that is it for the glute bridge exercise. All right. So let's move on to the last exercise in this module. Okay, so the last exercise we want to show you today in this hip imbalances module is an exercise known as the reverse mini lunge. All right, now this is an exercise that you can perform while standing and can be a nice alternative for people who just might not be able to get on and off the ground comfortably. But this is one of the best ways to help you kind of fix a lot of these imbalances that we've talked about, to teach you how to get a lot of that pressure off your back, especially for people who have a lot of back pain while standing and walking. All right, so Tweet, let's go ahead and reset. All right, so what Twee's going to do here is she's going to start by just taking a nice big step back with her right leg. And from there, you'll start to notice that her pelvis and her hips is kind of at a downward sloping angle. So what we want to do is to help her correct that position by helping her, one, to squeeze her glutes as tight as you can. And then step two is just to kind of zip up her pelvis by just kind of engaging her abdominals. Now you can see here her pelvis is a lot more level and much more neutral. And then the last part of the exercise is we want to just have her bend her back knee just a little bit. And what this is going to do is going to create a lot of stretching and a lot of opening within the muscles in the front of the hip and the front of the thigh, while also teaching you how to engage your hips and engage your glutes to help take some of the pressure off of your back. Go ahead and stand back up. All right. And go and reset. And let's just practice it one more time. All right. So again, a nice step back with the right leg. Let's first start to level up the pelvis, level out and zip up the pelvis. Perfect. And if you can move your right arm up to the side a little bit here, so you can see here her back is also staying nice and flat. And one thing I want to show you is that when she kind of loses her pelvis or kind of loses her abs, which we go ahead and do it before you reset, you start to see that her back starts to kind of overarch. All right, so a very important part about this exercise is to teach you how to create that kind of straightness and levelness of your hips and your pelvis, and it's going to help reverse that kind of excessive lower back curvature, which will again take a lot of that pressure off your lower back, and from there just bend that back knee down just a little bit to really increase a lot of the stretching and a lot of the opening that you'll get into the front of the hip and the front of your thigh. And 3, 2, 1, and go ahead and stand up and reset. All right, let's just demonstrate on the other side so people can just kind of take a look. 3. All right, so same thing here. Left leg back this time, and bring your arm out in front so people can kind of look at see what's happening at your back. So again, when the pelvis is kind of forward like so, you'll start to see the lower back tends to want to arch. So a big part of this exercise is teach you how to squeeze the glute and kind of zip up that core, which will help you level out your pelvis. And this is going to significantly increase the level of stretch that you're going to get in the front of the hip and demand a lot of the activation of your glute. And just again, it's a nice slight bend of that back knee and hold there for a couple of seconds. 3, 2, 1, and stand up and reset. All right. All right, so that is it for the reverse mini lunge, and that is it for our 3 favorite ways to help you fix and reverse some of the most common hip imbalances, all right, that we see for a lot of people who might be struggling with chronic back pain. I hope that these exercises help, and we hope to see you all again next time.